Let's talk about microneedling. I am Hannah, your skincare specialist at Aesthetic Alchemy, and microneedling is one of my all-time favourite in-clinic treatments. I'm at home at the minute, which means I don't have the clinic pen with us, but I do have one that I use at home. I do not recommend treating yourself at home unless you are fully qualified. There is a lot that can go wrong doing this, so make sure that you're getting it in clinic from a qualified practitioner. Okay, so this is the pen that I use at home for microneedling, and what it is there's a tiny little cartridge on the end, and these are disposable. They're one use only, so this will get thrown away immediately after I've done the demo. And they come with a different count of needle in there. This one is a 12 needle count, and we use these lower count needles for more scar remodeling. So if you've got scar tissue from acne or past trauma, then this is going to be more effective. The higher needle counts, up to sort of the 36 needles, are more for general collagen boosting, skin resurfacing effects. So I don't know if I can show you on the camera if it will pick up the little needles that are in there. And what happens is when you attach the cartridge to the pen, you turn the pen on, and the needles move rapidly, really quickly to penetrate the skin, and we're very slowly then working the pen over the skin surface so that it penetrates. There are different depths that we can set the pen to. If we look around the bottom here, okay, and generally I wouldn't go any deeper than a 1.5 on most people. When you've got the scar tissue that we want to work on, then I would go deeper. You don't need to go deep to get the effects. You don't need to go really heavy and hard. Okay, you see these people that are bleeding, that is completely unnecessary. So how does microneedling work? Well, these needles create micro injuries in the skin, and I know that sounds quite scary, but it's a very precise and controlled injury to the skin. And what that does is it triggers your body's natural healing response, which will then produce more collagen and elastin in the skin. Now, collagen and elastin are the structure that keeps our skin looking firm and bouncy, and it has that snapback. And we lose 1 to 2% of collagen every year from around the age of 25, so quite significant reductions as we get towards sort of my age. I'm heading towards my mid-40s, and it's really hard to build that collagen. Our body sort of slows down in our collagen production. Elastin production has basically all but stopped a long time ago, so anything that we can do to help regenerate this collagen in terms of anti-aging is going to be absolutely fantastic, which is why microneedling is one of my favorites. So microneedling, we know now, works on helping reduce fine lines and wrinkles by boosting the collagen, and acne scarring as well, but also it can help reduce the appearance of pores, reduce the texture in the skin. It can help with pigmentation in the skin. It really is an all-rounder fantastic treatment. Now, in terms of results, you may see a little bit of a glow within a few days, but the real results are more gradual. Okay, so if we think about the skin cell turnover, the natural skin cell turnover is usually between 4 to 6 weeks, and as we get older, it is slower. Microneedling does help speed that up, but still we need that time to see those textural changes upon the surface of the skin. And with regards to collagen, we're looking more towards the sort of 12-week stage for the collagen to mature and become that more stable structured collagen in the skin. So anywhere between 4 to 12 weeks you should really start seeing the results. We do recommend a course of treatments, 3 to 4 treatments spaced 4 to 6 weeks apart, to really get things moving and to really see those results, and then maintaining regularly after that to kind of keep things boosted. So we mentioned about how the skin loses collagen quite rapidly as we get older, and we're kind of trying to replace what we're losing each year by stimulating it through microneedling. Something that's really important with microneedling is what serums you're using, because they can have added benefits on top of this damage repair cycle. We can use things like growth factors, we can use things that can help with pigmentation, exosomes, so we're all kinds of serums that we can use to help regenerate the skin, to get the cells working better, Yeah, so serums are really important. They must be formulated for microneedling. There are so many risks of using serums that are not specifically formulated for microneedling, which can include things like granulomas, which nobody wants. So what to expect immediately after your treatment? Downtime really is quite minimal with microneedling. You can expect to be red for the rest of the day, the next 24 hours. If we've done deeper depth for the scar revision, then maybe sort of up to 72 hours you could expect some level of redness. Some people experience peeling. That is more common again with the more aggressive treatments. Most people don't experience peeling. I would say avoid wearing makeup until the next day, and be very mindful of what you're applying to your skin. So avoid things like retinoids, because they are going to penetrate deeper, because we've created these little micro channels into the skin. So any actives that you put on are going to be a little bit too aggressive and can cause irritation. So I'd recommend avoiding things like retinoids for maybe 3 days after your treatment. Microneedling is one of those treatments that works with your skin rather than against it. It is gradual, it's regenerative, and the results will appear better over time with more treatments. If you're consistent with it, it can really transform the quality and texture of your skin. So how painful is microneedling? Now, for most people, it is not really painful at all. You don't need numbing cream. It feels kind of like a satisfying scratch. Areas where you have less fat, so maybe like the forehead, the nose, you will feel it more. But where we have the fat pads sort of in the cheeks, you will barely feel it. Like I said, it's like a satisfying scratch feel. When we're treating things like scarring, we are going with a lower needle count, so you do feel that a lot more. We're going deeper depths and you feel that a lot more as well, and numbing may be preferable in those circumstances. But for most people, it is absolutely fine. So if you're looking for a treatment that isn't going to change the overall structure and shape of your face, but is going to improve the overall texture and tone of your skin, then microneedling is most definitely the treatment for you.